You are watching your award-winning cable access station, Channel 13 and 19, Athol Orange Community Television.
Welcome to Quabbin Valley Health Links, a presentation of Quabbin Valley Healthcare in partnership with AOTV. This program is designed to link members of the community to health-related resources available in and around your local community. We serve to provide information on healthcare-related matters and other resources so you can make better, more informed healthcare decisions. Please visit us at qvhc.com for more information. Welcome to Quabbin Valley Health Links. I'm Michael Cacciadorian. On today's program, we have Denise Fournier, Home Care Representative with CAREtenders VNA. Welcome to the program.
Thank you so much, Michael. It's so great to be here.
Glad to have you here. Part of Quabbin Valley Health Links' mission is to link people in and around the Athol community to healthcare resources in and around this community.
Fabulous.
Because we want to help people identify what's available to them. And CAREtenders is one of those services that I think is very important that people get to know how to connect with you and what types of services you offer. So CAREtenders is a visiting nurse agency, am I correct?
Correct.
And what does that mean?
A visiting nurse agency is an agency where we have employees who are nurses, physical therapist, occupational therapist, speech therapist. We also have social workers who actually come to the patient's home and provide care for them there. And it's individualized to what their particular needs are.
And we were talking earlier, you said that CAREtenders is part of a bigger company.
That's right.
And the reason why we want to mention that is because if somebody watching the program decides to visit your website, they may get a different name. So can you just talk about your parent company, where they're located and how that works?
So our parent company is called Almost Family. They are located in Louisville, Kentucky. And it's been in business for well over 30 years. And what they've done, and they've seen a need for people to get the care that they need at home. So our CEO and founder had family members and decided he was going to start his own business.
So he had family members that needed
services
at home?
And really didn't like the things that were happening to his family. So took it upon himself to start his own business. And our mission does come from him and that instance. And basically, we are senior advocates committed to providing home care to individuals in their home, but we look beyond the obvious needs of a person.
I see.
We also want to look at their emotional, physical, and mental well-being.
So Almost Family is the parent company.
Yes.
Then they own visiting nurse agencies.
Yes.
And in geographical locations like yours here in the greater Athol area.
Yep.
Where's your office located locally?
Locally, our office is in Westboro, Mass.
And where is your coverage area? Although you're in Westboro, you are very much covering this area.
Absolutely. We cover Orange, Athol, Phillipston, Royalston, Templeton, Gardner, Fitchburg, all Worcester, West Brookfield, Ware. We have another office in Holyoke that is just starting up, and they're working out further west, but we want to do that slowly because we're building up our staff. And what we actually do is we hire people that are local to the community.
Right.
So I'm from Gardner, and we have physical therapist who is it right over the line in Ringe.
Okay.
So we take people who are really committed to home care and providing great care from these local areas.
So there are people in the community caring for people in the community, regardless of where the office is located.
Because
I think that's important.
Right, because people don't need to go to that office. We come to you.
That's right.
So
we're in this same healthcare field together, so to speak. I mean, a lot of what Quabbin Valley does,
a lot of what you do.
Absolutely.
They're interrelated, and yet they have separate aspects to it as well.
Absolutely.
So we feel the value of a service like yours is very important in this community, or in all the communities
Absolutely.
that we serve. If somebody, take us through the process
Okay.
of I need VNA services. So
Okay.
as an example, I have a family member who's ill. They go to the hospital for whatever the medical event may happen to be.
Right.
And it's determined at the hospital that you could go home if you have support services in place.
Right.
Through a visiting nurse association
Right.
agency.
Right.
So what happens at that point? How do you get involved to determine if this
That's a
person
great-
meets criteria, and what happens?
Okay, that's a great question. So what normally happens in a hospital setting is there are nurse case managers or social workers who are in charge of setting up that home care when somebody leaves. And they will get in touch with the VNA. And they generally will come and ask a person, do you have a preference? Because people need to remember that they absolutely have a choice.
Yes, good
They have a
point.
choice in where they want to go if they need rehab after a hospital, like going to Quabbin Valley, or if they're just going to go home and they're going to have VNA services. They have a choice of who that's going to be. So they would just say, I've heard about CAREtenders. I'd really like them to be my VNA when I go home. And that person at the hospital will then contact us. What that does is it triggers myself to come on out to the hospital. I get to go through the medical record. So we have information about the patient before they go home about what went on, what brought them to the hospital.
I see.
Maybe they had a procedure or surgery. Maybe medications are being changed to try a new coordination of medication, whatever it is. So I gather all of that information. I then send it to my office, and we schedule our visit for when that person is going to be discharged.
So at the hospital, you're essentially collecting a history,
Yep.
and then the present events that led them to the
Exactly.
hospital.
And
But will
demographics.
You'll visit them in the hospital too. So the patients at the
yes.
hospital, you'll actually go in.
I will go
you
in.
visit with them and kind of help them and talk to
Absolutely.
them about what to expect.
So I introduce myself. I explain a little bit about what home care is, because some people have never had it. Some people have in the past, so they understand it a little more. I always give them my direct phone number, because I always tell people no question is silly.
That's right.
Especially when you're dealing with your health. People can call me for any kind of question. And I also give them the name of the person that's going to be managing their care in the office. And then we just go over where they live, because we want to send the nurse or the
Sure.
therapist to the correct place. Make sure we have that correct demographics, the name of their primary care physician as well, which is very important.
Why?
The reason why that is so important is when they leave the hospital, we get physician's orders that give us legal permission to go out and see that person.
I see.
But the orders we get from the hospital are only good for that very first visit.
Oh, I see. Okay.
The rest of their care, we are going to then contact their primary care physician, let them know about their patient is coming on service with us, send them the information that we've obtained from the hospital, so they are totally up to date and on board what's going on, and then we communicate with them and get our orders from them.
And that's a little bit different. I don't mean to
Yeah.
interrupt. That's a little bit different than when you're at the hospital, because all of a sudden your primary care is no longer involved.
Exactly. Exactly.
Which has its benefits, but you also do
Right.
lose a little bit of contact with your primary care physician. So
Right.
this is great in that
Yes.
somebody's receiving home health services.
Yep.
It's directed by their primary care physician.
primary care physician. And so if a nurse has a question about a certain medication, or even say somebody's come home after they've had some type of joint surgery, meaning they've had a knee replacement or a hip replacement, or even if they have a fracture due to a fall, I gather that information as well about who their surgeon is, who that specialty doctor is, whether it's an orthopedic surgeon or a gastroenterologist, whatever the specialty is, so
Sure.
we can contact them as well. So we have our orders from their primary care, and then if there's any specialties that are involved, we also communicate with them just to make sure we're doing exactly what needs to
Sure.
be done.
So if somebody's coming to you with a hip replacement, you're going to talk to the orthopedic surgeon.
Yep.
And determine what are your limitations.
Right. What are their parameters?
Precautions, hip
and
precautions, and you're going to maintain
Right.
those
Right.
based on their
Exactly.
feedback.
So
and
our
requirements.
therapist will get information like, we only want this person's hip to go so many degrees this first week,
I see.
which is going to let them know what they can do for exercises or strengthening and getting them back on their feet to where they were before that surgery.
So, good news now, I'm being discharged from the hospital. Right?
Yay.
Everybody, I think.
Yes, exactly. That's
one
a
of their,
very
one of their
happy
favorite
day.
days, right?
Yes.
So, what happens now? I'm home.
Okay, so you're
When am I
home.
going to see you?
And so what happens for a VNA, it is regulated by Medicare. So when you discharge from the hospital and say you're going to go home Thursday, our nurse will see you on Friday. We are not allowed by Medicare regulations to go in the same day.
So, okay, so it's going to be the next day.
So it's going to be the next day. Our nurse will generally call maybe in the evening on that Wednesday, but definitely Thursday morning, and introduce herself, say she's calling from CAREtenders. She's going to be the nurse coming out, and this is what time she's scheduled to come out and see you. And they don't give a specific time like 11 o'clock. They'll say, we're going to come between 10 and 12.
Right, because they're seeing other people in their home.
They're seeing
and if
other
something
people.
is keeping them at that
Absolutely.
home, they
Absolutely.
can't really commit to a time. That makes sense.
And you know, you're nervous enough coming home from the hospital, and we don't want to increase that. So, you know, people, when you say 11 and you're not there at 11:15, it can make you very nervous.
That's right.
So we try to give them that time range instead.
Okay.
Then what happens is the nurse comes. That's usually the longest visit with the nurse because they do have to do intake information. And they will do vital signs. They'll ask a lot of the same questions that the person's obviously answered prior.
That's a good point because we see this a lot. You and I, when we're in the
Yes.
hospital, we're seeing people.
Yes.
And they'll often say, "Well, I've already said this to
It can
15
be
other
very
people,
frustrating.
you know, in the last 4 days. Why are you asking me this?" But I think people need to understand
Yes.
that even though in this day and age we are electronically connected, we still have a long way to go with that sharing
Absolutely.
of information.
Absolutely.
And it really is for the benefit of that person. And it may
Correct.
trigger a question on the nurse's behalf to say, "Well, wait a minute.
Right.
Let me ask you this." So I think it's important that the patient, the family understands that don't be impatient. We're not doing this because we don't understand.
Right.
There's a purpose behind it, and it's actually very beneficial to the patient to find out as much information as we can.
Exactly. Like, say somebody has an allergy and maybe it was missed in the hospital or it didn't get transferred on the paperwork.
right.
So they're going to ask you those questions, or maybe what kind of diet somebody's on. You know, if somebody has a cardiac condition, they need to be on a low sodium diet. Or maybe if somebody has swallowing issues, the consistency of food can be important
Right.
as well. So there's no choking, and that they can still get the nutrition that they need.
And your intake individual will communicate with the families, the patient's family. So
Yes.
even though the patient's still maybe at the hospital
Yes.
on Wednesday, anticipated to go home on Thursday,
Yep.
the people that you're helping to coordinate this through are also the patient's family.
Exactly.
So the patient themselves doesn't have to interact with you
Exactly.
until they get home.
Absolutely. Absolutely. My visit with them is more of an introduction, just to let them know services are being set up. Because when you're laying in a hospital bed and you're thinking, okay, I'm going home tomorrow, I'm having a VNA come, but nobody's come to talk to me yet, you're kind of wondering, are they really going to be there?
That's right.
So I just want to allay any fears that they may have, that yes, we have the information, that we're going to be there to see them, that everything's all set, they don't have to worry about it. Which is really nice, and
Yeah.
I've had people really say thank you.
Oh, I'm sure.
It allayed some fears.
Of course. Yeah, I
So,
think the more people know,
the better
the
they
better
are.
they understand
Absolutely.
what to expect. So there's a nursing component. The nurse is going to take this information, run it by the primary care physician if there's any medication changes or orders that need to be signed off on.
Yes.
And let's go with that scenario that somebody had a hip replacement.
Okay.
So we understand the nurse will come up with the nursing component of it.
Yes.
But there's also a rehab component of it.
Absolutely.
So
that's really important.
Who determines that piece? Is the nurse going to determine, or
Nope.
is there a therapist that's going to come in?
There's
and
going to
work
be a
with the patient?
physical therapist, and we usually send physical therapy and occupational therapy. Some people don't see the need for both, but they really work together.
Sure. So just to back up a little bit, so we're talking physical therapy generally. We're thinking waist down.
Right.
In occupational therapy, generally we think waist
up.
So
Right.
in terms of a fractured hip,
Right.
you're wondering why occupational therapy, but you're right. There's a
Absolutely.
convergence of the two.
Exactly. So why somebody might need occupational therapy or does need it is you're at home and you have your hip replaced. How are you going to get in and out of the bathroom to shower, to bathe? How are you going to make your cup of coffee?
That's right.
You don't think of those things,
right.
but I've been there myself with a fracture and looking at the cabinet going, I can't reach that.
Right.
So what they'll do is they'll come in, they'll have you try to do those certain activities of daily living, like bathing or dressing or making yourself some food or a drink, and then will make recommendations. You know, it might be better to move that coffee pot over here, and it might be a good idea to put these glasses here. And you have a lot of scatter rugs in your kitchen. At this time, get them out, because that's a hazard for tripping. If you're using a walker, your walker's not going to roll. If you're using crutches, you could slip and fall, and that's not what you want to do.
Right. And I think people take for granted that it might sound like the obvious, but
Yes.
When you're in the situation,
Yes.
you don't see it
You don't.
as often.
You don't.
You sort of don't recognize these
Absolutely.
things. And there are certain things you can't change, so you have to do a workaround.
Exactly.
So occupational therapy, in some respect, with PT, physical therapy,
Yes.
will help you with that workaround.
Absolutely.
Whether it's a reaching device or something else.
Absolutely. They might even come in and the physician says, their hip cannot go before a certain angle.
That's right, sure.
We can, they're very good and very creative. They'll help raise the bed. They might put boards underneath. Everything is stable. So people don't have to go run out and buy a new bed or a new mattress. They work with what you have, but they're very ingenuitive, and they can really come up with some great things for people. And chairs, you wouldn't realize it, but chairs are a lot of different heights.
Yes.
So they can help with that. Maybe raise a cushion, put another cushion underneath to raise something up, or sometimes things need to be lowered.
Or even how to sit into the chair and get out of the chair.
And get out of the chair
the
safely.
right way, safely.
Yes, absolutely.
So there's a lot going on.
Absolutely.
VNA in general is a temporary service.
Absolutely.
Okay. The time frame is going to be different for each person, but
Yes.
overall it's a temporary service.
Yes.
What does that entail for the average individual who's going to receive your services? So in every other day, are you bringing services more at the beginning? How does that
Okay,
work?
so we do front loading, which basically means more services at the beginning, because that's when you need it the most. You're still recovering from an illness or surgery, so we want to be there more. And it's decided by the nurse and the therapist. They'll put a plan together. They'll make an assessment of the patient themselves, of their house, and then they'll put a plan together and say, you know what, you're doing great. We feel we can come 7 days a week. You're very motivated. You're healing well, so we're going to come 7 days a week. And they might do that for the first week.
Right.
Now they've met some short-term goals, what they're going to do and saying, you know what, you're doing great. You know how to get in and out of your chair safely. You're getting better about getting in the shower. We're going to come 5 days a week. And they talk about this with the patient.
Right.
So the patient is really part of the schedule. So they understand. And the therapist and the nurse, they all set goals. They set short-term and long-term goals. So as you're progressing, you're healing, and those goals are reached, then the time between visits starts to extend and extend until finally we discharge you because you're fine, you don't need any help anymore. And that's really the ultimate goal.
Absolutely.
Yep.
Let's talk about another scenario that I think happens more often now than in the past. So if somebody, Quabbin Valley's in the senior care industry.
Yes.
You primarily work with elderly folks, senior citizens. A lot of times people are coming in to the hospital with not just the fractured hip,
right,
but they have a whole host of other medical conditions that
absolutely,
quite frankly, could be working against them in respect to getting better as quickly as possible.
That's very true.
So along the way, on what we call the continuum,
yes,
so after the hospital, they're going to come to Quabbin Valley first.
Right.
For short-term rehab.
Yep.
And the reason why they may do that is because they're so debilitated and they can't go home safely.
Exactly.
And but our job at our facility, or other skilled nursing facilities for that matter, is to get somebody to the highest level of independence as possible. And when they're ready to go home safely, they can go home.
Right.
So we're not going to keep somebody at our facility for any extended period of time that they don't want to be there.
Right.
We want to make sure that they're safe, that they've reached goals. And we've had a lot of success in that respect.
Yes.
But we have to discharge somebody home with services.
Yes.
Because that's the right thing to do. They need continuation.
Absolutely.
They don't need 24-hour supervision on our end any longer because they progressed and they don't meet the criteria to stay with us any longer. So then we call a place like CAREtenders and we say, okay, we have a person who 6 weeks ago this happened.
Right.
You're going to essentially do the same thing as if that patient was in the hospital.
Absolutely.
You'll come to Quabbin Valley or another skilled nursing facility and this process starts pretty much exactly the same way.
Exactly.
And I think what's great about this in general too is working relationships with one another.
Yes.
If we discharge somebody, they go home, they sign on to CAREtenders. You guys are looking, monitoring, working with that patient, working with that family, but you're realizing something isn't going well. The patient's not progressing like they should, or they have a different medical event that sets them back.
Yes, that does
You're
happen.
going to call us perhaps, right? Or the other skilled nursing facility you're working with and say,
actually, that's the first thing we'll do.
Mr. Smith came home, it's not working, he needs to come back.
Yes.
And we'll have him come back
Absolutely.
and continue that inpatient rehab.
Yes.
And then again, we'll connect with you and that
Yes.
person's ready to go home.
Yep.
And so I think that's a great service for the community.
It is a great service because if you don't really need to be in a hospital, who wants to be in a hospital?
Right.
And who wants to be in an ER if they don't have to be?
Exactly. Well, that's a good point because we can help that person, if medically appropriate, bypass the emergency room and come right back to Quabbin
Valley. And go right back to
Valley.
Quabbin. We'll call. We'll find the right person to talk to. We'll get all the information to Quabbin, and then that person can just go right back to Quabbin, get the care that they need. And then when they're ready to come home again, they can come back home with CAREtenders and we just start again.
Excellent.
So it's really a great process for people.
So at this point, let's talk about insurance.
Oh,
that's
yes.
a big one.
That is a big one.
I mean,
Absolutely.
particularly these days.
Yes.
So there are so many variations, so many different insurance companies, so many different visiting nurse agencies that take all kinds of insurance and some that don't. Your sort of your approach, I think, is more specific. You're working with people who only have Medicare or Medicaid.
Right.
Is that correct?
Correct.
Okay.
So Medicare needs to be their primary insurance. They can have any secondary insurance, but we do not contract with any insurance companies like Fallon Senior or a Tufts Medicare preferred plan. At this point in time, we've approached them. They tell us that their panel is full, that they have enough VNAs who they have contracted with and don't feel that they need another.
Sure.
So what we focused on is the Medicare patient.
Okay. What
it's actually turned out to be really a very good thing. because with Medicare, our clinicians and our therapists are very skilled in the Medicare policies, and they can, when somebody comes home, when they send, because they have to send their paperwork to Medicare, we can get 3 months to see a patient as part of their plan. Now, they might not need that whole 3 months
Correct.
because they meet their goals, but sometimes, like you said, somebody can have a setback, or it's just very slow going because they might have a lot of other medical issues, or they might have emotional issues as well. If somebody's just lost a spouse, that really does affect how you heal and how you progress. So our therapists then can resubmit to Medicare a new plan, and their documentation is so great that we get approval for another
That's
3
great.
months.
I think that's important too, because
Yes.
a lot of, for clarification purposes first. So for Medicare, people generally 65 and over.
Yes.
Somebody who's perhaps been disabled
Yes.
for an extended period of time who may be under 65. But your primary insurance for the most part is
Yes.
going to be Medicare. When you're working with Medicare replacement products, like Tufts Medicare Preferred
Right.
or Fallon Senior, people
Right.
should understand that that's a Medicare replacement.
Yes.
So I know there's a little confusion there.
So they
that-
are managing your Medicare
right.
for you.
And you can't take that patient.
Right.
Because that's considered an NHMO.
Right.
So they have to have strictly Medicare
Strictly
only.
Medicare.
But they could have a tough supplemental plan.
Right.
Blue Cross supplemental.
Absolutely, like a
Fallon
MedX or a
supplemental.
Fallon
Correct.
supplement or Medicaid, or they can just be straight Medicare and have no supplement.
Right.
And that works as
That
well
works
too.
Okay.
Under Medicare, there is no cost to the patient for home care.
Oh, okay.
It's covered 100%. So they won't get a bill, they won't get a copayment. So that works out really well for the patient. And Medicare has 2 parts to it, Medicare Part A and Medicare Part B. What's really nice about that is if say that somebody's planning to have their hip replaced, we do have a new program that we're starting to roll out in this area. It's been very well received in Boston by the Boston physicians from CAREtenders, something called prehab. So when you go see your doctor, you know you want to have your hip replaced.
Right.
You're going to have the surgery.
So the elective surgery.
The elective surgery. We can come into your home before surgery under your Medicare Part B. We can assess your home, make those changes, talk to you about what you're going to expect at the hospital, kind of what's going to happen, how things are going to go, which takes a lot of anxiety out of a person, which makes your outcomes so much better.
Absolutely.
You recover better.
That's right.
And they'll give you exercises to do beforehand to strengthen your body and your hip or your knee. So when you do have the surgery, that recovery goes a little bit smoother and a little bit faster. And what's really nice is we send that same person back to your house after, so they've already developed this relationship. They know it's going to be, say, Kathy, and
That's
they,
right.
and they know her, so they feel more comfortable when they're in that hospital, knowing, okay, Kathy's going to be there when I get home.
Right.
So
And people shouldn't underestimate that.
absolutely.
There's something to that.
There
it's
really
very,
is.
very important. That alleviation of any type of extra anxiety
Yes.
is very important.
Yes, it really does matter. for
So
your
I'm going
recovery.
to need to read this. So CAREtenders, you have multiple areas of specialization.
Yes.
So you have senior care management.
Yeah.
Optimum balance, polypharmacy medication management, the Breathe program, Geri Psych program, which is geriatric psychiatry program,
Yep.
telehealth,
Yep.
home orthopedics rehabilitation, urology services program, cardio care, transitional care, memory care, and dementia. That's a lot going on.
It is a lot.
So let's just maybe take senior care management.
Okay.
What is that? My understanding is, if I'm correct, again, talking earlier with you, is senior care management with CAREtenders is part of what you get. It's not an
Exactly.
add-on.
Exactly.
It's something that's providing added value,
Absolutely.
but you automatically get it.
You automatically get it. You don't have to ask for it. Basically, what that means is in our office, you're going to have a case manager who's a nurse, who's going to be overseeing your whole care. They're going to be looking at what the nurse is doing. They're going to be reading reports. They're going to be following up with the nurse, following up maybe with the family, making sure things are going well. They're going to be making sure you're getting the physical therapy that you need and that it's there in a timely manner. So this all happens behind the scenes. You don't even know what's happening.
I see.
And
so they're helping you coordinate your care.
Absolutely.
Really is what they're doing. Okay. So that could include your next follow-up appointment.
Yes.
Yes. I don't know, maybe enhancing services further, getting a family member in contact with a family member.
Yes, we will do. We generally go above and beyond. Our, as I mentioned, our mission is senior advocacy, and we really take that seriously. So, you know, maybe somebody has an appointment with a physician's office and, you know, they're not sure if the therapist is going to come in that day. You know, all they need is a quick call to our nurse case manager, or she'll be calling them as well, back and forth, just to see how things are going. They also do a follow-up call to make sure, are things going well from your point of view, from the patient's point of view. And we have to remember, everybody has a different personality, everybody has different needs, and maybe sometimes therapists we send isn't just clicking.
Sure.
So that's not a problem.
Else.
We'll send somebody else.
Absolutely.
And I never want people to think, oh my gosh, I really can't say anything because then they're not going to be nice to me.
No, I think that's a very good point.
Yeah.
The choice and advocacy,
absolutely,
in my viewpoint, are paramount. I
absolutely.
Those are the aspects of your healthcare that you can control.
Absolutely.
You can have a voice, and people shouldn't be afraid. And
yes, I tell them
I think that's such an important thing. So whether you're dealing with having to come to Quabbin Valley or dealing with needing home health care services, you have that right to ask questions, to talk about choices, and to advocate for yourself.
Absolutely.
As does your family.
Absolutely.
And we don't, as professionals, we don't take offense to that.
Absolutely
we actually
not.
expect it.
We do. And people that do this type of work and the people that work for CAREtenders, they love what they do.
Yes.
They put their heart into it. So they want what's best for that person as well. They're not offended. They don't take it the wrong way. They just see it as actually a good thing that somebody is speaking up for themselves and kind of putting it out there of what they need or what they want.
Absolutely.
And that just works so much better for everyone.
Well, this has been a lot of information.
I know, it has. It's been wonderful.
It's been great information.
Good.
It's been a pleasure having you here.
Thank you.
And I just wanted to let people know that if they actually just want a consultation with you directly.
Absolutely, you can call me.
You can call Denise at 978-424-7901. And that is her direct line, and she'll help you answer any questions you may have.
Yep.
You can call their main office in Westboro at 508-366-7031.
Right.
And don't let that deter you, because you cover this area very extensively and comprehensively. And they also have a website called CAREtenders.com. And as we mentioned earlier, you would be directed to their at-home,
Almost Family
website. Don't get alarmed, but it is part of the CAREtenders group. And you'll be able to get information about all these programs.
You will, right online.
Insurance information.
Absolutely.
A lot of the stuff that we spoke about.
Yep. And you know, if somebody does end up calling my office, they'll call me. My office will call me. So we just feel it's more great to have more hands-on, face-to-face.
Sure.
You know, I can meet somebody for a coffee. I can meet them at Quabbin Valley. I can meet them in the hospital. Or if they just want to talk on the phone and just ask some questions.
That's right.
You know, we might not be the agency for you, but we also like to be able to be there as a resource. Whether it's for you, Michael, or your patients, or the community in general.
And we do the same. I mean, it's just what we do. We want to give everybody choices and good information.
That's right.
Well, thank you, Denise. It's been wonderful having you here.
It's been wonderful to be here.
As usual, thank you all for watching. And also, for more information, please visit Quabbin Valley Healthcare at qvhc.com. Thank you for watching.